Hi, welcome to the Mom series, The Misunderstanding of Multiplicity. So the first video was a little scattered because I was rushing and cooking, and now I've got everything in my hand so I can just kind of relax and take my video and concentrate on what I want to say. So, first things first, my spaghetti marinara is done. It's actually not spaghetti, it's angel hair pasta. And I use, let me get my wooden spoon back. I washed everything up really quick. I need my wooden spoon. Okay, so, you know, if you go to a grocery store, like I used to buy those frozen spaghetti marinaras that you steam up in the microwave. And I just wanted to say quickly, I have hardly 3 different meals from one pot of sauce by doing this. So I made a meat sauce, that's in the freezer, and I've got a few meatballs set aside in the freezer, and some sausage links set aside, just a few little chunks. And then just by taking a carrot and celery and onion and a little bit of crushed tomato, and a little bit of paste and water and some chicken stock, low sodium, and a little garlic, and I just used the little assorted peppers and just steamed those up, let my tomatoes reduce, and then tossed my my angel hair pasta in that. I was able to make a whole other, this is going to be like 6 other, almost 6, 1, 2, 3, could be 8, because this is filling, because it's got mushrooms in it, it's got peppers, it's got tomatoes, there's a little meat in there. And so I was able to make a whole other dish. And go to the store where I live, anyways. Try to buy those. I don't get any brand names, but you know, the steamable microwave, even the low-calorie steamable microwave frozen dinners, which I use. Sometimes I'll still grab like one of the Michelina dollar ones, Lean Cuisine or something like that. I want to mention the brand, but anyways, sometimes I'll still grab a few of them, but some of them are like, you know, they're all made up like angel hair pasta with mushroom and zucchini and all that, and you're looking at $3 for a little tiny cup, not even a cup, not even. And this, you know, just by throwing a little bit of angel hair in there with my regular my sauce and my vegetables, I've got a nice little marinara going there, and then I still have my meat sauce in the freezer. So that's that. Okay, so I wanted to talk. Oh, my cooking's done. I'm gonna put this on low. I'm gonna let it simmer for a little while. So I mentioned bipolar because the most mail that I get is, "Hi, I'm new to DID. I've just been diagnosed. I've been diagnosed bipolar for years," and then a slew of alphabet soup. And it's been going on for years. Usually it's younger folks, and sometimes it's women and men that are between the ages of, I'd say 17 and their mid-30s, and they'll say, "Well, you know, I was diagnosed with this, and this, and now my new doctor thinks it's DID." Okay. First of all, I'm not a doctor out here. I'm just giving you my opinion. I was diagnosed with DID in 1986, and the criteria that was followed, and I know a lot of people self-subscribe to being multiple, so I'm just bringing this up because if you really are going by the DID model and the DSM, or even the UK manuals, or multiple personality from years gone by, dissociative identity disorder, I hate that name, was diagnosed in the exclusion, in the absence of a major mood disorder. That would be like schizophrenia or bipolar or schizoaffective disorder, or like a major mood disorder. Bipolar is a major mood disorder. in the absence of an organic or medical condition, bipolar is an organic medical condition, and I will explain to you in a minute why. And in the absence of all substances, when the client is reporting lost time, sometimes feeling like they disassociate, any of the dissociative experiences that one could have, or finding clothes in your closet that you don't remember you bought, or getting home, now remember how to get it. If you look at the DES scale, which is so ridiculously not just the only tool to diagnose a person with, but I've noticed a lot of people in awareness groups are taking that DES, dissociative experience scale, and then thinking, that's just one tool. So the greatest tool you have is, I'm going to say it in the order it is, time. Time is always on your side, believe it or not, it always is. It will out the truth in what's going on in your circumstance, always. People who know you consistently, who have known you, some people have written me and said, well, I can't be around people because I have social anxiety, and I have this, and I have that, and I have and I have panic disorder. I mean, they have everything. Or they get triggered too much from all their traumas. Understood. But how do you know how you're really behaving then? If you don't have if you don't have an objective opinion. So it's good to stay with a therapist, and then usually a psychotherapist who is being followed by a psychiatrist. A therapist isn't enough. When you're being diagnosed, and I'm not for psychiatry, and I'm not all gung-ho psychiatry, but if you find the right compassionate psychiatrist who's not going to be out there just pumping big pharma at you and looking to slap any old label on you, but somebody that can look at the medical, that can do the blood work, or even a primary care doctor that's working with the therapist, and you're not hopping around. Time is on your side by looking clearly at how many times a year do I quit my job and go off into another career? How many times a year do I decide I don't want to be in this relationship? Everything was going good. I was moving forward, and now I don't want to be with this person. I just don't want to be with this person. How many times in your life have you just gone traveling and not told anyone, said, you know, I'm just going to go. Or I'm shutting down another journal. I'm shutting down another account. I'm just shutting everything down. I'm going. And then come back full steam ahead. How many times have you gone into a project of art or writing or music or anything, pursued school, and then thought, I'm not, forget it. Forget it. No. Impulsive behavior, impulsive decisions isn't, sure, it can be found in DID if doctors are saying, oh, well, I'm looking at alters, I'm seeing different people all the time, sure. But in patterns that you can track. And I know some people with bipolar go up and down all day, and some people are more switchy and switch more. Here's the reason I really wanted to stress why it's so important to stay with a consistent doctor, to not shun a diagnosis like bipolar and then think, well, you know what, my new doctor said it's DID, and not use the excuse of, well, most people are in the psychiatric community for 7 years being diagnosed everything before it's DID. Yeah, that's part of the criteria. But in the absence of other mood disorders, in the absence of any medical condition, and in the absence of substances such as alcohol, marijuana, I don't care if it's synthetic or naturally grown or whatever, alcohol, marijuana, caffeine even. Caffeine is a drug, yes, caffeine. In the absence of antidepressants, Adderall, Ritalin, anti-anxiety medications, and then medications that you're on for physical things. All of these things alter the mood. Best example I can give is when I went for a research study for lupus years ago. I was on Plaquenil, which is an anti-malarial drug that can work for rheumatoid arthritis and some people with SLE. And I could not go into that research study until they washed me off every single medication I was on, including the Plaquenil. Same thing happened when I went for a fibromyalgia study. I had to, even though I'd only been on one Soma for the past 3 years, one a day. It was a muscle relaxer, even though I'd only been on one Transine a day. It was an anti-anxiety, so I had to get off everything to be on that to find out if it even worked. So that's science for you. So if people are showing up, at a clinician's office with tapering up a medication, tapering down a medication, sure, it's part of the history, but I don't think we understand really how much that affects lost time or lapses in time or derealization or depersonalization or time going fast or our behavior being erratic. And it really does affect sleep patterns, it affects depression, it affects activity level. So, but the thing I want to say the most is if you're bipolar, there should not be a shame to that you would want to like discard that and say, oh no, I'm not bipolar. My doctor said I could be bipolar and DID, so I don't have to take medicine now because DID, blah, blah, blah. Okay, yeah. DID, you don't need the medication for it. It cancels it out, usually. Some people can be on antidepressants or anti-anxiety or medications. But if you're sharing a brain, everybody's going to eventually succumb to that pattern, that downward cycle, or that upward cycle, or that in-between cycle. And everyone's going to fall into that, okay? More importantly, why it's organic, doctors have proven that if a person is bipolar and continues to have one episode after another, with each episode of mania, hypomania, or severe depression, the brain degenerates to the level of what is found usually on MRIs and CAT scans and observation of those with schizophrenia and Alzheimer's. There are only two categories that your brain can look that way, and that's on too many bouts of depression, too many bouts of mania, up, down, with every episode. It is a progressive, degenerative brain organic illness, and it is manageable, and there is treatment. So that's the good news. The bad news is, if you keep saying, well, I don't want to go on my medication and not have my highs, because then I can't get anything done, or I don't want to be on any medication at all because I don't want to see anyone, I just want to do my thing, and my doctor said it's DID, and that's just other alters acting different. If you want to go that route, you will have brain damage in your older life. You will. But people with DID, so far they haven't seen MRIs where they have brain damage. They've seen evidence in the amygdala of reacting to trauma triggers, of memory when they ask them to remember something, but they have not seen degenerative through the years where the brain actually degenerates to that of an MRI, or where you can see schizophrenia and you can see that disorganized thinking and Alzheimer's of complete cognitive abilities going down. So please use your doctors and your time wisely, and thank you for writing. And I finally just wanted to say this without any fear that anybody's going to get all, I'm not a doctor, not a clinician. I've done a lot of research and studying on this. Observation, time, in the absence of organic illness, in the absence of medical conditions, in the absence of substances, if you go and then are experiencing lost time, derealization, depersonalization, another person, things in your home, other people telling you were calling yourself by a different name, you write different, you find, then, in the absence of all the other, then a clinician usually begins to think dissociative disorder, then maybe DID. So I wanted to say that. Thank you. Have a nice day. That's a video response.